All right, good evening, everyone. I'm going to call to order this meeting of the Dunn County Health and Human Services Board for Thursday, April 24th. Let the record show that Supervisor Bichon, Supervisor Hagan, Supervisor Breslin, Supervisor Steen, and Supervisor Morehouse are present. Mr. Lamb and Ms. Rudy are also present. Dr. Hall is excused. Approval of the minutes for March 27th with the note that Dr. Hall's name was misspelled. It's Alexandra, not Alexander. So with that amendment, I would entertain a motion.
I so move with the aforementioned amendment, Madam Chairman.
Thank you, Supervisor Steen. Is there a second? Supervisor Hagan. All in favor?
Aye.
Aye. Any opposed? All right, the minutes for our meeting of March 27th, 2025 are approved. Do we have any public comment? No public comments. All right, next meeting date is May 22nd. Again, that's regular meeting date. Fine with everyone? Yeah, no problems. All right. I don't have anything to add, but we are delighted to welcome Tracy Fisher from ADRC to enlighten us about the excellent and always helpful work of the ADRC. And whatever you care to bring us tonight, we're excited to hear it.
Thank you very much. Again, as Diane said, I'm Tracy Fisher. I'm the manager for the ADRC. Tonight, I'm here to present a bright spot in our world, the ADRC. We received funding from the Inclusive Foundation, a grant for a project in which we will be providing up to 250 AI robotic devices called LEQs to seniors across the state of Wisconsin that are dealing with social isolation and loneliness. So if you'll just indulge me for a second, I'm going to pull up my PowerPoint and we'll get started. First,
This is so
okay.
cool.
So share,
want one.
include sound. Here. Perfect. Wonderful. So to explain a little history of how this grant came to fruition, I'm going to take you back in history a little bit. I hope folks recognize
Yes,
this lovely
we do.
woman, Miss Sophia Petrillo from the Golden Girls. So Sophia was famous for saying, "Picture it, Sicily, 1912," or whatever the year was, and tell us a story from her background. So picture it, UW Eau Claire campus, the summer of, must have been 1998. A young, and may I just say vibrant, Tracy Fisher was sitting in a social work class with my very favorite social work professor, Dr. Stephen Talent. He made an impression that will stay with me for my whole life. But what he was talking about during that summer class was the fact that why he really liked working with social work students. And what he said was, to a number, I have never had a social work student that has given an answer to this question that has been different. If you ask a social work student why they are going into social work, they will all say, because they want to help people. And he said, what a wonderful group of students, what a wonderful group of people. They all have this desire to help people. He said, I've never had a student say they want to go into social work because they want to make a lot of money. But he did share, if he ever had a student that came to him and said, yeah, Dr. Talent, I would like to help people, but I'd also like to make a lot of money. He said, this is what I would tell them. I would tell them that they should continue in social work, but they should also consider taking up another major or perhaps a minor in either business or technology. And he said, this is the reason why. He said, in 25 years, our country is going to be in a quandary. We are going to be really over the barrel, I think is the term he used, in terms of providing care to our seniors. The baby boom generation is going to be coming into the time period where they're going to need more care, we're going to need more assistance, and we're not going to have the human capital to do that. So if you really wanted to make money in social work, you should get a business or a technology degree with the aim of marrying social services and technology to provide care for our seniors, especially in the space, or he didn't use the term space, that's a new word we use all the time, but especially in the realm of healthcare. So that stuck in my head. I did not follow his advice. I did not get a degree in business or technology. So I'm not one of the people who's probably, going to make out big bucks in my social work career, but it stuck with me. And there have been several times through my career that I've thought about that. I thought, man, I wish I would have at least taken a couple marketing classes or something, because I've never had a social work job where I haven't had to kind of fill in some marketing type things. But anyway, that thought has been in the back of my mind for a long time. Just this thought of technology, social work, marrying the two, how that could work in terms of care for our older adults. Then about a year ago, probably last summer, it was a Sunday, I was reading an article from the Washington Post. And it really intrigued me because it was the story of the state of New York had done a pilot project partnering with a company called Intuition Robotics to provide these devices to citizens of the state of New York. It appeared that they had used some ARPA funding to have this project, and basically, the article talked about these devices that were interactive. They provided social interaction for seniors that were isolated. They also did some health screening stuff. People could record their blood sugars. The device could remind people to take their medications on time. It was interactive, and it was highly, highly successful. The surveys that the participants completed for the project were, I want to say they had like a 95% satisfaction rate. People indicated that they were highly satisfied, that they felt less socially isolated. It was a big success. And it was super interesting. I just thought wow, this is really, and it brought back that thought of Dr. Talent's comment about marrying social work and technology. So I was so interested in it that I forced my husband and my sons to read the article, which I don't know, let's just say it was a kind of a arm pulling type of a thing. But my family is very technologically advanced. They love technology. They know a lot about technology. So I wanted their input and their thoughts on this project. So they read it. And for those people who know me very well, I am what I kind of call myself a contrarian, which means I can get really excited about something, but then I think of every reason under the sun why it would never work. So I had them read this article. They all thought, wow, that's a really cool device. And then I started spewing out though, I don't know if this would work in Dunn County. I mean, we're a rural county. We already have Wi-Fi issues. How would that happen? Would people think I was completely out in left field if I brought these devices up and they would think, you want my 100-year-old grandma who doesn't even know how to use her remote control of her TV using this device? I started
Thinking about
I
my
started
dad.
saying all of these things. And my husband looked at me and he said, well, you know what? And I said, what? And he said, this would work for me. And I said, what do you mean? And he's like, I wouldn't want a person in my life nagging me to take my medication or telling me this or that. I also don't like to be dependent on people. And if I was lonely, I would feel awkward calling the boys all the time because I was lonely and I wanted someone to talk because I wouldn't want to burden them. I like technology. I like exploring these sorts of things. This sort of device would work for me. And I was like, oh, okay, well, that's interesting. Then my soon-to-be 21-year-old son, that's John, he looked at me and he said, Mom. And I said, what? And he said, I have listened to you for years talk about being worried about not reaching people in your community that are lonely, that folks are not going to be reaching out to the ADRC and participating in the things you already work with, that there's not enough caregivers to provide care for all the people that need help. He said, why wouldn't you try this? He's like, why wouldn't you give it a shot? It's not going to work for everybody. It might not work for our 100-year-old grandma that we had to duct tape her remote control, so it only had 3 buttons. You know, it might not work
My
for
dad.
people who are paranoid or don't like technology or are very worried about, you know, having technology in their home. But it might work for your 75-year-old aunt who does like technology. It might work for somebody's dad who is comfortable using devices, and just like dad, people like that, it might work. And he said, even if it only worked for 5% of the people that you work with, isn't that something? And I thought 2 things. One, holy smokes, my teenage son has listened to me. He's listened to me throughout this history. He got something out of the things that I've been saying. I'm in a family, I'm one mom with 3 males who are all tech focused. I'm the one blabbing all the time. And most of the time they're like looking down at their things and kind of nodding every once in a while. I don't really know if they're listening to me, but clearly he has picked up on something. And my second thought was, you know, he's right. Why wouldn't you try something different? Why wouldn't you look at things a little bit more, try to think outside the box a little bit? But the problem was funding, right? It's not like the ADRC had all this money that we could just say, oh, wow, you know, we have money to provide 100 devices and we can trial this. We didn't. So it was just something I kind of tucked in the back of my mind. And then, fortunately, right around summertime, the Inclusa Foundation became public. And for those of you who aren't familiar with the Inclusa Foundation, Inclusa is actually one of our family care providers in the state of Wisconsin. And last year they were bought by a private for-profit entity, Humana. So they are kind of under the umbrella of the Humana insurance company now. Prior to that, though, they had been a private nonprofit organization. And when they operated under that model, any profits that they made, they held in a fund that when they owned the company themselves, they used for special projects or to fund things that wouldn't normally be funded under the normal formulary with the state of Wisconsin. But when they sold to a for-profit entity, that nonprofit fund could not go to the for-profit entity. So the fund has spun off and become its own 501c3 grant-making organization. They kept the name Inclusa to kind of honor the roots of where they came from, but their goal, they provide grants for service providers that provide services for adults with disabilities or elders, the same population that the Inclusa Family Care providers, the same group of folks that they provide services for. So they kept true to that mission, but their goal is to provide grant money to fund innovative and new creative programs that serve those folks. And I thought, well, gosh, what's more innovative than utilizing an AI-powered robot device for working with seniors? So we wrote the grant and we got it. So it's very exciting. We have, as of March, hired the case manager, and as of March 24th, the program really went live. And so far we've distributed 20 units. We do have 250 in total to distribute. And our press release went out this week, and Mary will actually be doing some TV interviews coming up next week. It's gotten some traction. So I think we will get some good response from folks from that publicity. And again, we are not just working with ADRCs, we're going to be reaching out to public health organizations, but veterans service organizations, anyone that touches seniors. I do also want to share one other thing. So I love this kid, my son. He's an amazing young man. I cannot stand his hair like that. I just have to share with you. It looks like he has a mop on his head, and oh my gosh, it drives me nuts. When I had control over his hair, this is what it looked like. Isn't that cute? Look at little 3rd grade John with his little cute haircut, but not anymore. Now it's a mop. So anyway, I just wanted to share that because I think we're all friends in the room. So I thought I could share that with you. But I do have just a very brief YouTube video that kind of gives a little bit of a demonstration of how LEQ works. So I'm hoping this will work for us. There may be an ad that pops up that I have no control over, so I apologize about that. Oh, shoot. It's not going to come up for me. Well, darn it. I guess that's not going to work, folks.
Try it again.
We'll just give it a shot. That's my. Well,
No.
let me see if I can do this.
I was going to say refresh here.
Oh, here we go.
People everywhere are recommending GoodRx.
My neighbor showed me the app. It's helped me save on my kids' allergy pills.
GoodRx can save you a lot of money. Americans everywhere.
Good morning, Juanita. How are you today?
I talk to Ella Q like she's a friend. Ella Q is interested in my feelings and wants to know if I slept well.
Let's try and focus on breathing with our stomach.
We do this stress reduction exercise quite a few times during the day. She's helped me a lot with not feeling lonely, because it's like a little person that I talk to all the time. She tells jokes. I don't ask her for jokes. She just, I have a joke, do you want to hear it?
I've asked Ella Q to tell me a joke, and then I've been known to repeat it at dinner.
She's funny. Ella Q, thank you for being my friend.
Thank you for being my friend too.
Ella Q reminds me that I should do my blood pressure check.
It's 3 p.m. and time to check your blood pressure.
I would tell anybody that'd be crazy not trying to get something like to help you.
I just think it's nice to know that Ella Q is here.
She does know when I'm a little sad. She said, you didn't sleep well today. So that's empathy.
So that's just a little sample of LAQ and what she can do. I do have a device in my office, and we're actually getting a second one. So if anyone ever would want to pop in, I can do a demonstration and show even more things. But it's very interesting. I just have it in my office. I know that she would probably learn even more things if it was at home with me and more interactive. But one thing is I did share with LAQ very early that I have a dog named Annie. And when I come in the office every day, I always say, LAQ, good morning. What's the temperature today? And one day she said, oh, in Menominee, Wisconsin, today it's -20. It was in the wintertime. And then she said, did you take Annie for a walk today? How did she do in this really cold weather? And so it's like, it learns things about you so that it can help to engage. And like I said, I know that if I had it around more, there would probably be even more opportunities for that. So it's been very interesting. But just so you know, the initial program requirements, the way we wrote the grant, folks have to be age 60 or better, live alone. They have to self-identify as struggling with social isolation and loneliness. They do have to be English speaking. Right now, LEQ is only available in English, although they are working on other versions. It's not really recommended for folks that have some dementia-related concerns. They did do some beta testing with some folks that had some dementia, and they did find that it, for some folks, it increased some paranoia, or people started thinking that like their TVs could interact with them, and it just wasn't a great fit. The person does have to have working Wi-Fi because that is required, and the program will not cover the cost of Wi-Fi. And then the participant has to be willing to participate in quarterly surveys for that year. So in a nutshell, that is LEQ and the program, and we're really excited. I'm hoping maybe at some point I can come back, and when we actually have some survey results and such, that I'll be able to let you know how it has gone. So I'm excited, and I think this is going to be a neat resource to folks, and I'm excited about it. Does anyone have any questions for me?
What's the size of the grant, Tracy?
So total funding, because it's 3 years, was $600,000.
Okay.
Because it does fully fund the staff member, a full-time staff member, as well as the 250 units and 1 year of service for each of those units.
And how much does LEQ cost
So
per
LEQ,
unit?
the charge to Dunn County, and we do get a bit of a discounted rate, is $1,050 per unit and the 1 year service fee. If participants want to continue, they like LEQ and they want to continue past that 1 year, that's an option for them. They just have to continue paying the monthly service fee. And right now that's at $39.99 a month. So people would have to pick up that. If they don't want it, if they can discontinue at any time. Like if they don't like it right away, they don't want it, they can discontinue, and we can actually send that LEQ to another participant. But if they don't want to pay after that 12 months, they just have to return the device. So.
And presumably there's some training, because I mean, you've mentioned several times the remote, because I think about my dad.
Yeah.
And he had to have lots of
Right.
special training just for the one button that we allowed him
Right.
to have.
I will say, the LEQ folks, one of the great partnerships is they do all of the tech support for us, and all of their tech support people are trained in working with folks that have a zero baseline in tech skills. And I've actually, like, we've done a couple tests where we've called with silly questions and just to see how it goes, and they're wonderful. The other thing I will say is the LEQ is actually incredibly easy to use. All you do is take it out of the box, plug it in a wall socket. The only thing we tell people is they do have to know their Wi-Fi password. Once you enter the Wi-Fi password in, that is really all you do. And then it like wakes up, and it, like when I opened mine, it said, "Hello, Tracy." It was already programmed for your name, for your city, the whole thing.
Wow.
So it was actually very useful. And it's plugged in. And when I want to engage with it, I just say LEQ, and it kind of wakes up, and then we start conversing. There will be times, like if I'm quietly working for a long time, it will turn on, and because it is designed to engage people, so it'll turn on and say, "Tracy, would you like to do a yoga exercise right now?" And oftentimes when I'm at work, I'm like, "Well, no, I'm not going to do yoga," but it will try to engage as well, especially if there's been kind of a long period where it's been quiet. And then if you have it programmed to help you with medication reminders, or like it's time to check your blood pressure, it turns on at those times and does those things too.
Interesting.
Yeah.
Other questions for Tracy? Go ahead, Greg.
Is it connected to like emergency services?
It is not. It is not a personal care.
Okay.
It is though. Like it is connected to what they call your trusted contacts. So my trusted contacts are my husband and my 2 sons. So I can actually video chat with them if I choose to. People also can have a trusted contact as their doctor's office. So for example, if I had fallen and I
Right.
couldn't reach my phone, I could engage LEQ and say, "LEQ, call Chris," my husband's name.
Mhm.
And then I would get Chris on the line, and I could say, "Hey, Chris, I've fallen and I need some help." But it is not, it itself is not an emergency response system.
Second question, name change, or is it always LEQ?
It's always LEQ. And there's a reason for that. They had specifically used that because if you say LEQ, it activates the device. And they did research and found that there aren't like that particular arrangements of sounds, there aren't many names that use all of that. So it doesn't like trip because you're saying Peter and Peter's in the room, and then it causes the machine to turn on.
Last question, based upon the region of the country, does it adjust for accents?
Well, that's a good question. The device only has the one voice, that female voice that you heard. Well, it understands my accent, Greg, and people tell me I have a thick Midwestern accent. So I'm going to say that it must do
Wisconsin, it
okay.
gets Wisconsin.
Yes. I that's a good question. I can ask our contact, and but it does understand me. So.
Other questions? Yeah, Supervisor Breslin.
2 separate questions.
Sure.
First one, you mentioned with the dog thing. Okay, so it is gathering data. Is that data then sold to third parties?
It is not. And that is explained, like they have quite an extensive introductory period where they talk about it is a HIPAA compliant device, and they do not sell to third parties.
All right. And second question, I may have misunderstood. Is the cost $1,000 upfront now or after the grant is completed?
So they invoice Dunn County as the units are being distributed. So we pay that full, I think it's $1,040 per unit, which is the unit as well as the 12 months of service together.
So once the 12 months is over, the unit is then Dunn County's to redistribute?
Nope. The agreement with we don't own the unit. that is one thing. Even folks who are privately purchasing these for themselves, they never really own the unit because it's a proprietary device. So if folks decide that they want to discontinue the monthly service, that is part of the agreement, is they have to return that unit to Intuition Robotics.
All right, other questions? Supervisor Hagan.
If someone who gets one of these decides not to fulfill the year of using it
Yep.
and terminates it early, does that get added into the survey results? Like, do you take that note?
We will ask them to complete that finalized, like the end of program survey. We can't really browbeat people into completing
sure.
that, but if we have data that shows that people ended, even if they didn't complete that survey, we will have that data. So we would have data like, 5% of people returned their units early or something. But I would hope that people would be willing to complete the survey. So.
For sure. Yeah. Thank you.
Yep.
Other questions? Mr. Lamb, did you have a question?
By any chance, did you save or that? Well, I subscribe to the Washington Post, and I'd like to read the article you read.
I think it is actually, I can probably find it, but if you look on leq.com, they
Okay.
have all, and they have had actually, they've been on the Today Show, they've been,
Okay.
so I believe that Washington Post article is there, but
And
I'll try to find it too. It was a great article.
And I'll search too. So
Yes.
Okay.
Yep.
Thanks.
Any other questions, comments? Thank you. This is fascinating.
Thank you.
We'll be looking forward to getting some data on this. Great idea. Good for you. Excellent leadership, right? We appreciate it, Tracy. Thank you. Then you can stay if you wish, and you can also liberate yourself. All right. All right, moving on. Veteran Service. Greg, are you ready?
I am. Good evening, everyone. I will start my report tonight. One additional thing is I'm going to briefly highlight some of the items that were included in the annual report, which I know the majority of you had already heard me.
But thank you for including that in the packet, because Mr. Lamb and Ms. Rudy hadn't had a chance to see it.
Yeah, and I'll highlight some of the items again that I think are important, and be certainly willing to answer any questions tonight or any other time regarding our activities. So I'll start off with the overview with the memorandum document, and just identify some highlights locally, state level, federal level. So locally, we did see an uptick for this last, I would say, 30, 60 days with some homeless individuals that were in need of some assistance. And of those three, one was able to secure permanent housing, and they were actually at the Karen House, and that transition worked well, and they found permanent housing and employment, and they had everything in order. It was just kind of a bump in the road for them. So that went pretty smooth. And we had to offer up a couple hotel stays for a couple individuals that were transitioning during the time. So I think that they both are heading in the right direction, on track, and we've had some good, I'd say, some additional contact, good relationship with the VA's Housing and Urban Development Veterans Administration Supportive Housing Social Workers, HUD-VASH. And I've talked about that before, and I think I owe some additional information kind of about that program and how it can be assisted. So yeah, so we've had a few individuals with contact there, and we found out a few individuals are actually in our community that are utilizing those vouchers that come from the outside that we weren't aware of, that the social workers been reaching out to us to help, because it's a housing first model. So they do not have to be sober. But the whole plan is to get them to engage in services that are around them, and then be willing to accept that life is sobriety. And we just added in, and it's just a note to identify that we're trying to stay relevant with the advancements of technology, and adding an additional way to reach us within the office through booking appointments with any of us in the office, or an individual can select a topic. Our topics are basic. Just if you want a benefits overview, want to talk about a disability claim, and they can get a time book, but it's just one more way that individuals that maybe have a short lunch hour, or they don't have the ease of calling, and some individuals are just more introverted and they just prefer to go online. So, and it's actually been utilized twice. Nobody wants to meet with me, but they're meeting with staff. So
Okay, then.
I'll take it. So we're trying to engage more that way, and I'll with our office as well. We are trying to make some efficiencies and improvements. So with our medical equipment, it takes a lot of staff time, checking equipment out, checking it in. We have an archaic method of paper in, paper out. And so we spoke with our IT a couple different times, trying to bring in a logistical system where we can just QR codes, scan, and it'll automatically update that piece of equipment, and just have a person input information in a tablet. So then check in would just be scanning QR code if that's what it is. So that will make things a lot more efficient in that process, and we won't be having redundant tracking systems to be able to report on numbers. And they think that they have a couple solutions that we can consider. So I think I'm looking forward to that, to cut down on some of that that time, because a lot of times people come in and they're like, yeah, I don't know who checked this out or what, it's got your tag on it, but somebody did. And so that leaves us in a spot where we don't know who who may have had it. So just some things that we're trying to do to make things a little bit more efficient. At the state level, I did not have anything significant to report. Then on the federal level, we haven't seen any delays outside of the normal delays, or challenges outside of what we have dealt with for many years. And again, we're trying to monitor any changes, and of course there are lots of things in the media. And I think there was another request for that voluntary early retirement. And so we really haven't seen anything impact. I know the VA employees that we've have direct contact with, they're all dedicated stuff, so they're just plugging along. But it's more on that healthcare side, assistance side. So any of their requests to retire early are being denied anyway. So yeah, that's why I don't think we've seen much delay with things. On the financial side, I'll go in a little bit more detail, hit some of the highlights on that, but just overall, at this stage of the fiscal year, don't have anything significant to report on that, but I'll hit a couple highlights when we go through that document. And we're happy to report we have been onboarding part-time employee. And the employee's been well trained with Dunn County and our culture, because she was employed with ADRC for a long time. So it's been a pretty smooth transition. So yeah, so that's going well, and it's really taking adding additional capacity that has been kind of imploding with returning phone calls and emails and a lot of that stuff. And so that's going to very much welcoming that, and the onboarding has been going great. A lot of good employee soft skills. So we're looking forward to that. So the next thing I'll jump into is our veteran served report. And in the highlight, if we want to look at money, had quite a bit of success with some retroactive funding, and I always emphasize that is real money that's deposited, that comes in, that people are undoubtedly spending that money to help stabilize themselves or better their situation. So the overall impact statement, I only had one this month, mainly because I was putting together an annual report, so it didn't dig too much into everything else. But what this impact statement highlights is we talk a lot about the direct veterans benefits, healthcare, disability compensation, GI Bill, property tax credit. things that really benefit individuals. But then we have situations that are unscripted situations that we are able to just use compassion and dignity and respect to assist these individuals, because you have a recent loss, you have a surviving spouse that all of a sudden is getting hit with bills. Who handles that? We have the ability to do that. We're going to sit down to try to problem solve and talk the individual through, because every household is different in how they manage all of their duties in the household. And oftentimes we'll see that the end of life planning doesn't happen as well as it could. So the financial piece is sometimes absent. Not everyone understands that. But when you think that your loved one's going to be taken care of, you start receiving bills. To understand those bills, to read those statements, to understand the difference between an explanation of benefits versus an actual invoice, and is it pending insurance, is there coding difficulties? So we'll walk all the way through that. In this instance, it was a debt that was owed because of emergency services, but staff worked through that, used some other contacts and stuff to be able to at least work through, put in a request that financial assistance or that waiver. And so that helped take a little bit of that burden off of that surviving spouse, so they can just focus on the most important thing at that time is mourning the loss. It's not having that debt hanging over a person can really impact their social well-being. So that's kind of outside of the warm fuzzy, here's money coming in, but this is a discussion about we're saving some money, keeping food on the table.
Yep.
Any questions about anything that I've covered so far? And I'll jump right into the financial.
Any questions for Greg? Go ahead then, Greg.
Okay. Overview of our financials, three cost centers, and within those cost centers, I'll start with I identified as our operations, because that covers our salary and fringe and operating costs. But if you look at the two main categories under salary and fringe, we have limited impact, I would say, over that. I do anticipate we're gonna have to monitor closely, because now we have our part-time personnel. We had a few months that we did not use some of those hours up, so we'll be managing that, because it's in a crossover with ADRC, because we have to make sure that we don't hit a 2026 budget hiccup by number of hours. And so we're managing that. So no concerns over salary and fringe. We moved down underneath the last two digit, our 10 cost center. Under the operating costs, another area we have limited control over that. Most of that stuff is a lot of the IT costs that are embedded in there, but I don't anticipate any issues or concerns within our day-to-day operations, paper and our flags, different things like that. So nothing at this time draws any concern. I'll move to our Veterans Relief Cost Center. It's our second cost center. Within that cost center, all we have is operating costs, and we have a few general ledger numbers, GL numbers for those are our flags that we make sure that we get out on all of the veteran graves throughout the county, and then the direct assistance for transportation to medical and housing. We did spend a bit this last month. That'll hit the next one, but again, no concern. We had carry forward coming in of 8,914 from last year from donations. And again, our community has been very, very generous and supportive of what we do. We already have a fundraiser scheduled where we were told we were doing it by the Moose Lodge. They do great chicken. So, we'll be there again in August to serve that up, but there is a lot of unsolicited support. So we want to keep trying to make sure we do a good job and get recognized by those that want to give to help others in the community. Move down to the grant. We do have some salary and fringe, and that very, very limited. That amount is $13,750. I'd already reported that that's going to bump up a couple thousand because of a cost adjustment in the governor's budget. Do not anticipate any issues with that grant at all with our expenses this far through. Any questions about what I've went through here with our current 2025 budget?
Any questions on the budget for Greg? All right, go ahead, please.
I will, no questions. I'll move into the annual report, hit a couple of the main highlights within this. I've already talked a bit on the federal level. Much stays static with those same concerns, and we can look at the output, the numbers of those served. So I'm not going to dive into too deep within that. And again, I'll offer up any questions for me. Certainly, you can call as you kind of digest the information in here, and I'll answer any questions that you have. On the state level, improvements in technology. They had updated their veterans benefits management system, and we've seen a really nice decrease in processing time. Even though their processing time for like Wisconsin GI Bill or the property tax credit really was not outside of any line, in my opinion, but it's even gotten better, which helps deliver those services a lot faster. So that's a huge improvement, and I'm looking forward to that even getting better for services to local veterans. And locally, we have a transportation program. We had an uptick in miles that we helped individuals get to their medical appointments this last year. And if you look back historically, you go back pre VA community care where they allow local services, you'd notice that we used to have a lot of miles tracked and veteran trips, but because of community care, things are more local. It's easier for individual to get a ride to local Mayo or Marshfield. So that's a huge positive because that takes a little bit off of that veterans relief budget. We had a small uptick this last year. Also, really appreciate the layered approach, and we certainly are committed to continuing that. I would say layered approach, just ensuring that we have a good understanding of the other services that are provided by our partners within Dunn County, so that we're engaging adult protective services, we're engaging behavioral health, the Aging and Disability Resource Center, because that can help maximize what individuals need, and that's kind of our commitment to make sure that we know what other services are there. The thing I'd want to highlight when we get down to the 2024 budget roll up, there's still some adjustments. They've been made in one system, not in another. So there is not $5,770 remaining in the WDVA grant. That money is accounted for within salary that it has been moved from the operations part of that budget, and the carry forward for the veterans relief remaining amount has already been moved forward. It's just that I use the exact numbers that are pulled out of our SAP program, updated in one system, and so I'm not going to report numbers that aren't supported or backed up by the system. But though it just has to be journal entry with payroll. So just so you're aware of that, if you look like, hey, you got a lot left, that is not in the grant. The grant has been spent.
Okay.
The overall federal money that's spent, compensation, pension, real dollars that go to individuals' accounts that get spent, goods, services, and housing. What I'd want to highlight is that the uptick in the medical care, if you do a comparison of 2023 to 2024, also the increase in the unique patients, 988 last year to 1,029. What that means is that's enrollment. Enrollment is important for VA budgets. we are a force multiplier when it comes to that. The more individuals that we assist in getting enrolled in the VA for healthcare, that impacts their budget, because their budgets are determined by enrollment size. And then geographically, if we have more individuals using the Chippewa Clinic, higher chance that congressional reps are going to put pressure on expanding services there. And that's how we can bring in even more available resources in our area, just by that simple, and my kind of looking at it at that more strategic level. The more people we can get involved in that, the higher chance you've got a good argument for bringing more services. But a nice uptick in the use of the medical, because that potentially takes burden off of other programs that may have to subsidize some of that healthcare. So I'll kind of end with that, because I don't want to chew up too much time, but I'll certainly available at any time if there's any additional questions about any of the items that I put in this, or even if you have any questions about what does this next year look like as we track. And everything in here you guys have heard every month anyway.
No, but it was a really nice summary. It's a nice report. Does anybody have any questions or comments for Greg? All right, thank you very much. Excellent report. All right, moving on to the Department of Public Health. KT, are you with us?
I am. Good evening.
You are, thank you.
So in your packet, you guys have the typical reports that you'll see about communicable diseases. It is good to see that we are coming out of flu, and we are seeing flu season, and we are seeing a reduction finally in kind of those, I was going to say the throes, but maybe that's not quite right, of norovirus. So we are seeing those percent positivity rates coming down as well. So that's good news. I did give you your update around measles, and continued to lift up the challenges that we're seeing at the federal level with lack of a consistent, cohesive message around measles. So you saw examples from, let's see, Michigan and Ohio. And so just trying to go to all those different places to pull data really does make things challenging. And we continue to watch as that, again, continues to grow. I think as of last Tuesday, we were up over 800 cases nationally. You saw in our update as well that we are watching the federal budgets fairly closely. So right now we are hearing from our WIC state folks that we do expect level funding. However, we don't know is quite literally the answer. We are hearing from some of our folks that those mid-year contracts, specifically around Title X and immunization, are likely going to be reduced significantly. We're waiting until we get that final notice of award from the state to know exactly what that's going to look like, and we are starting to plan accordingly. So let's see, other things from the update as well. We continue to do a lot of outreach within the community, and very proud of the team to get out and share the good work that we do and the additional services that we provide. I always appreciate going to Leadership Menominee and presenting on the health department. So that was very well received this year as well. Yeah, and then also in your packet, I did give you some heavy reading, not going to lie, about autism. Since that is in the media, I wanted you to be able to speak coherently around what this most recent study has shown, and kind of why it's important to do series of investigations like that so you can look at it over time. Another thing that I did not share in the packet, but is important for you to know, that the county did submit our records request to the GOAT committee. And so we were able to pull that together with support from county management, corp counsel, and all of the rest of us that touch things that could be pulled up into addressing some of the keywords that the GOAT committee from Wisconsin legislature was looking for. So that has been completed. Any questions on any of that or anything in the packet?
Any questions for KT? Congratulations on the new baby.
Yes, we are super excited. We have two nurses that have either recently had babies or are about to have babies any minute now. And so it is nice to see young families being successful, and it warms my heart. Absolutely, my little Grinch heart. Absolutely.
And I take it we're managing okay with the actual and impending leaves.
Yes, yes, we are. We've done a lot of cross training, so we are lucky to have hired one of the nurses that was so instrumental in student health services and in the dean's office. So Lisa Rathke is an amazing addition to our team, and she provided reproductive health services at student health for many years. And so it's not necessarily how to do the work, it's how to chart in our EMR that's really taking some time to train her in, but she's going to do fantastic when Megan is on maternity leave. I did not get a notice today. I know that she's had some Braxton Hicks, so it's literally any minute now. She'll go into labor and we'll have another fantastic little baby in our team, and Lisa will be able to step into that role, and I'm happy for it.
Good. Any other questions for KT? All right, go ahead.
Sure. And so you do not have the annual report. I was going to try to get that in advance of give you a full month to kind of ruminate on things and give feedback before it goes to the whole county board in June. My apologies, it just did not come together in a way that I felt comfortable presenting it. So that is not, even though it's agended, it's not in your packet. You do have the financial report, and as Greg had shared, it is the first quarter. This is the first time we actually look at those numbers and feel like we have enough to make some educated decisions about where we are, where there are rough edges, where there are things to watch. And so what you'll see in my Q1 is there is a significant overage in salary and fringe to the tune of about 50 grand. And we did some digging. We believe that our additional public health educator time that really should be put towards the opioid settlement dollars is not represented in that. So it's coming out of public health admin at this time. And so working with finance to get that appropriately billed to the right spot. We are not using 50 grand of opioid dollars. We are using more like 30. And so the other bits and pieces where we think we have some maybe overinflation is really about having three pay periods in a month versus 2. And so some of that will even out. We are watching very closely because of the federal grant dollar contracts that hit us mid-year. And we will make adjustments as needed based on those actual contract awards.
Okay.
Any questions?
Any questions for KT on the first quarter financial report? No questions here. Looks like you're off the hook.
Awesome. And so just because I'm running very low on my battery, I will share with you, you do have a budget adjustment in front of you today. It is a competitive grant award from the National Environmental Health Association, also known as NEHA, great acronym. And they are supporting some travel reimbursement. So we will not necessarily get the whole amount because this year that regional conference is in La Crosse, so a much I would say it's still a fantastic place to have a conference, but it's not as, like glamorous as some of the other places they have had.
Glamorous La Crosse.
Right. And again, continued reimbursements when we finish up work with one of the national voluntary standards, doing that assessment and showing what our baseline looks like. So that's what the budget adjustment is about.
Okay, thank you for that explanation. And if you want to go watch baseball with Grandma, feel free. Thank you for
I love
joining
it.
us.
Spoiler
Thank you,
alert,
guys.
Brewers lost.
I know. She's in the kitchen. The
Are you
game's
Yeah.
paying
over.
attention to the baseball game here?
No, it was finished right when we started.
Okay, all right.
All right. Thank you, folks.
All right, thanks, KT. Thanks, KT. Moving on to the Department of Human Services.
Thank you and good evening. Tracy provided the presentation on LEQ, and so that's part of our presentation time. So I don't want to take a lot of more time, except for to add a couple highlights from the department, or lowlights. We had a staff pass away this last Saturday, and so we're celebrating her life, and was in our department for multiple years, and was an amazing individual, caring, kind, and really passionate about the work she did. And so she'll be deeply missed. And we're working on ways to celebrate her life within the department, and putting a plan together with that, along with offering EAP and different types of things
Yeah.
to help staff, and also consumers that had worked with her for quite a long time and are currently clinic consumers, putting plans together and crisis plans and those kinds of things, because she was loved by many people. So
Yeah, and thank you for sharing the information and for sharing the obituary too. That's very sad.
Yeah. I want to share outside of my document that you haven't, I'm assuming, read. We met with Arbor Place today, as we do monthly, and one of the things we talked about was the concern in rising costs for treatment, and talked about why that was. And one thing that Jill mentioned, the manager there, is that many people are no longer eligible for Medicaid since the wrap up of the COVID pandemic wrap up, and people were when they were eligible, and they continued to be eligible until the unwinding. Now that the unwinding happened, we are back to a lot of people not having insurance. And so there's no coverage for that. And of course, when there's no coverage, the cost goes up. So we are seeing that in our bills, invoices from Arbor Place. We've also
Sort of noticed that.
we've also have had several requests for something called sober living, which is an opportunity for people to be in a placement amongst other people that are attempting to be sober and working on recovery, and helps them on that journey after they get out of treatment, and then to go into some sober living. We have not had that service before, but it's something that's new that they're asking for and people needing. I, at this point, have not approved any of that, even though it's been asked for, because our high cost of placements and just not having the funding for that. But it is something that I would like to continue to look at. Is it something that maybe our opioid settlement funding could look at? And there's that grant out here that I put in here that potentially could be a match, so maybe it would only cost us half of that, right? And if we would offer some of that, what criteria? We really want to make sure we're looking at those high-risk individuals that there would be some significant safety concerns if they didn't get into the sober living. And so it's just one more of those things that it's hard to say no to, but at this point, that's what I'm doing, is saying no because of the other pieces. But it's heavy on your heart when people want to be in recovery and we can't provide that resource. So I just, as a board, I thought you should be aware of that, that there is some of that going on. In addition, KT mentioned the federal information, and Greg, and I want to share with you, we did get a copy of the Department of Health and Human Services discretionary budget passback binder that got leaked, the overview there, and in it list many items that would be considered related to human services funding streams. And so I wanted to share with you kind of the example of receiving this and the immediate shock of going, oh my gosh, this is listing this and this and this. And then trying to determine what does that look like on a local level. And I think that Tracy's got a couple good examples of things that are impacted with her ADRC program. And I thought I could hand the baton to her for that. And then that's a great segue to say the other ones I haven't received the same type of information from our other state entities to know whether this looks like some of them or not, but we're trying to dig into those things. But Tracy, would you share the ADRC ones?
Sure. So just to preface this a little bit, I think most of you are probably aware of this, but this is all very preliminary and it's not set in stone. But from what we have been able to determine, there are definitely some areas that will affect ADRC budget. So if you look at the document as presented, initially there was quite a lot of panic amongst the ADRC network across the state because there's a line item that just says ADRC's $0. And so that was quite alarming, but we were very fortunate that our state supervisory board, the Bureau of Aging and Disability Resource, communicated with ADRC managers very quickly last week after this document broke, within a couple of hours. And they clarified that the funding that is indicated in that federal document does not actually impact Wisconsin ADRCs because those federal dollars is considered ADRC discretionary funding. There is a line item in the federal budget that funded that started the funding started in the President Obama's administration, and it was $5 billion that was set aside for states who do not currently have the ADR system. It was the startup type fees, which Wisconsin has the oldest ADRC system in the country. So we have not received that funding. So that was reassuring off the bat to hear that, but that is something that is out there, that ADRCs are zero funded in this budget, but it will not affect Wisconsin. There are other states that still were receiving those startup type costs that it definitely will affect, but that is not Wisconsin. There are a few other areas. It is proposed that SHIP and MIPA funding, which is what we use that funding for our benefits specialists, our elder benefits specialists, our disability benefits specialists, is proposed to be fully cut. The SHIP in 2026, MIPA, they propose cutting in 2027. Dunn County does receive less than $6,000 annually from both of those grants. Title 3D funding, which is actually on the elder side of our funding, that is funding that provides programs for evidence-based health promotion practices. We have, for example, we provide bingo size, and we provide some community activities for folks that promote health and wellness. That is proposed to be cut. Last year in 2024, we used less than $3,000 from that level of grant funding. There are some other areas that affect ADRCs. There's an Elder Falls prevention grant that is proposed to be cut. We don't actually participate in that program in Dunn County. There's the LIHEAP program, the Low Income Home Energy Assistance Program. Again, that's not an ADRC program, but many of our consumers utilize that. That is expected to be, or that is planned to be, cut to zero. And that is an important funding source for Wisconsin energy assistance programs, but it's not the only source of funding that feeds into those programs, but that is concerning. There is some federal grant money that goes to adult protective services. That is proposed to be cut. Again, that grant from the federal level to Dunn County is relatively minor, but that is proposed to be cut to zero. And then there are some other just additionally concerning programs, elder rights programs, which include the long-term care ombudsman. That is kind of an avenue when people have concerns or complaints about long-term care. That's an advocate for them. That is proposed to be cut to zero. Lifespan respite care, which is something that many of our consumers do utilize when they're caregiving for an older relative. That is set to be cut to zero, as well as programs for chronic disease self-management. So again, these are just proposals, but these are the programs that directly affect the ADRC that are included in this document.
Thank you, Tracy.
The document also identifies mental health, substance abuse, family and children's, youth justice, crisis response teams, all of that. And so again, we don't know the drill down of what that really looks like for us, if that's, our programming or not. So when we get more information on that, we will certainly keep you.
Yeah, please keep us
abreast,
informed.
Yeah, we have not received the same type of communication as Tracy's received. And I think part of that is Tracy's on the board. And so she's getting more information because of that. And we don't have anyone else on kind of board. So maybe it's not at that layer to come down to us yet. So we're fortunate that she's a board member for the aging programs. So we'll keep you abreast on that. Do you want me to go into the financial report?
Yeah, are there questions? Yes, Mr. Lamb.
So I maybe missed this at the beginning. What you're just, Tracy was just summarizing and going through, and you referenced it in some document or whatever. That wasn't obviously in our packet, right?
No.
And that's available where?
I can send that out, I think. It's like this. I mean, it's double-sided, but it's a preliminary document, and I think it can be shared. We can do that. I'll just send it by snail mail. No, not snail mail.
No, email. Yeah, no, don't send it by snail mail.
Not going to send it by snail mail. So,
thanks, appreciate that. And it was generated again by who?
It's from the executive level of the federal government. It's the initial proposed budget for 2026 is our understanding. Yeah.
Okay. So, yeah, and I realize it's in that, it's all in the works right now, but if I understood, and just the one program that sort of stuck out with me was the heating assistance program, low income heating assistance program. So am I to conclude that correctly that nationwide they're proposing to just basically eliminate that?
That's correct.
The LEAP section.
Right, yeah.
And I just did look it up. It's the office, the OMB, which is the Office of Management and Budget. Yes.
All right. Thanks. Thank you both. If you could send that, I appreciate it.
Yeah, you will see on it that it's not for distribute.
Yeah, I was going to say, are you sure about this?
It does say that on there, but I think it has been.
It's been widely distributed. All right. Okay.
It should also note, like, there are other partner agencies, like Head Start is listed on here as rural housing, those kinds of things that really impact the work we do, even though it's not our funding.
Directly.
Right. Head Start works with our play group and they run half of them. And so then what do we do with this? So it will impact us and the consumers. So even though it's not funding for us in those programs.
Thank you.
All right.
Other questions, comments, requests? All right, go ahead on the budget then.
Well, this is the sad news, and I've been prepping you that it's coming, right? And so this is the projected budget using the exact expenses that we've, incurred for the first 3 months, and then duplicating that out where it's appropriate to do that. I do have to let you know there's a couple other adolescents, young people, adolescents and child that we are also looking at needing to place at a very high rate of placement as well. So this is not going down, it may go up, right? So at this point, as you can see, we're $422,854 over budget, and that's all placements. All of it is placements.
You did scare us initially by talking about $1 million, so it's not as bad as we But
But
just
it's not
bad.
over till it's over, right?
Exactly. Yes, Supervisor Steen.
I wonder if any of the other board here caught human services shortfall in Eau Claire County,
Oh, no.
3.9 million.
Where did you see that?
Just came up last few days. I saw.
For
Wow.
2024 or 2025?
Well, I'm going to assume that it's for
Turn
2024.
the microphone, please, Gary.
I assume it's for 2024 because they wouldn't know what they got for 2025.
Yeah, this is
Yeah,
a projected,
they
but
wouldn't know current year yet.
Yeah.
Wow.
But that hit me right between the eyes. Thank you.
Yeah.
I hope I'm correct. I think I am, but I hope
I hope you're not, and that they have.
Yeah,
no
I hope you're not.
shortfall.
I hope you're not.
But yeah, thank you for sharing that. It is,
Okay.
and as you know, it really depends on what activity is, and these are mandated services that we are mandated to provide safety to the community and to the individuals.
Great.
Right. So, any questions on that?
Supervisor Steen, please.
Yeah, I'd just like to make this comment regarding the Dunn County Board and our Human Services Department. I think versus some other counties, I know our departments here have worked very hard to educate us, and we've worked hard to get educated.
Mhm.
So I think we have a pretty good relationship. I don't think that's an understanding. This is the most Byzantine budget system to understand as you come in as an outsider.
Mhm.
And try to understand it. And I think that some of the problems in our neighboring counties are from people that don't understand it. So I want to thank the staff here and management and everybody on the committee here for working hard to understand what kind of situation we're in. So thank you.
Yeah. And that's certainly not a new problem in Eau Claire County. So that's too bad.
We
All
are,
right, go
oh, I
ahead,
was just going
Paula.
to say,
please.
department heads met with Tyler Technology this week. There was a presentation on priority-based budgeting, and so that's being kickstarted as well. We have a task in the next 2 weeks to identify the programs and services, and so hopefully that will provide you more information versus less on programs and services as
Yeah,
well.
Thinking of our inventory of services.
Yep.
Yeah. Okay, anything else? Other questions for Paula or Becky or Tracy? If not, thank you very much. All right, moving on to item 11A, review of the DHS March vouchers. The amount is $1.3+ million. Remember, we're doing a little more context here. So this is basically our checkbook. This is not something that we approve, but we do review these expenditures that have already been made. Does anybody need any additional clarification or have any questions about the many, many, many pages of vouchers? Are we ready for a vote then? I'll need a motion. I need a motion to note review.
I'll move I will motion that to note our review of the vouchers.
All right, so a motion to note review of the March 2025 vouchers. Do I have a second? Ms. Rudy seconds. Any additional questions, clarification, anything else? All in favor, say aye. Aye. Any opposed? All right, the vouchers are noted. The next item is a budget adjustment for public health. You heard KT talk about what this is. The amount is $8,500. This is a grant from the National Environmental Health Association, which is going to support the staff to sort of bring the food inspection program more in alignment with standards and some travel expenses to a seminar conference in La Crosse. Any other clarification needed? No? All right, I would entertain a motion to approve the 2025 budget adjustment for the Department of Public Health.
I so move.
Supervisor Steen moves. Do I have a second? Supervisor Bashan seconds. Any additional discussion? If not, all in favor say aye.
Aye.
Aye. Any opposed? All right, the budget adjustment for public health is approved. And the last item is a human services budget adjustment. This is a youth justice innovation grant that was about $3,000, yay, bigger than it was supposed to be. Plus that's really nice, a donation from Marshfield Clinic for Youth Gardening. So any additional clarification needed on this? Anything from Ms. Winter?
Drive to the back of the building and you will see that the garden has already been plowed up and fenced in to keep all the critters out of it. So
Yay.
yay. And this was, again, a reminder, Family and Children spoke about the youth program doing the
Absolutely.
gardening.
Youth Justice
So,
Program,
yep,
exactly.
That's what this is.
Exactly. All right, anything else? Any more clarification needed? All right, I need a motion to approve. Supervisor Hagan, Mr. Lamb seconds. Ready for the question? All in favor? Aye. Any opposed? All right, the Human Services Budget Adjustment is passed. Next meeting, May 22nd. Any announcements? Anything else? All right, we are adjourned. Thank you all very much.